Don't let this happen to you. It started with a pop. That's exactly what he said. A 64-year-old man, healthy, married, retired. He was having sex with his wife when he felt something strange. A sharp bend. A snapping sound. Then came the pain and swelling. He didn't know it yet, but his penis was fractured. Yes, that's a real thing. And yes, it happens more often than you think. I've seen men come into the ER with tears in their eyes, not just from pain, but from fear. Fear that they'll never be the same again. Fear that they'll lose the one thing that connects them to their masculinity and their partner. But here's what breaks my heart the most. In almost every case, these men had no idea that what they were doing was dangerous. They weren't reckless. They weren't irresponsible. They were just unaware. That's why I'm making this video. If you're a man over 60, or even over 40, and you still want to enjoy a healthy sex life, if you want to protect your erections, your confidence, your relationship, then I need you to listen closely. Because I'm going to walk you through 10 critical mistakes that men make with their penis. And no, these aren't myths. These are things I've seen with my own eyes, in real clinics with real patients. When your penis starts to fail, it's never just about sex. It's your body's cry for help. Your penis is like a warning light on your dashboard. If it stops working, something else is already going wrong: your heart, your hormones, your brain. That's why every man needs to treat his manhood like a health barometer, not just a bedroom tool. And before you think this is just about scaring you, it's not. This is about giving you power. Because when you understand what to avoid, you can take back control. And when you take care of your manhood, your whole body benefits. I've seen men in their 70s come back stronger, more confident, more connected with their wives, just by fixing a few simple habits. So don't wait until something snaps. Don't wait until it's too late. Here's what we're going to cover in this video. The silent signals that your penis is begging for help. The common things men do at home that lead to injury, shrinkage, and erectile dysfunction. The emotional traps that make things worse, even when the body is fine. And how to preserve your manhood even after 60. No one teaches men how to take care of their penis. But today that changes. If any of this speaks to you, stay with me. This might be the most important video you'll watch this year. And before we dive in, do me one favor. Leave a comment with your biggest question about your sexual health. I read every one. If this video helps you, hit like and share it with another man who needs to hear it. Because you never know what someone's going through until it's too late. Now let's begin. Mistake number 1. Ignoring your penis. He came in for back pain. That's what he told the nurse. But once the door closed and we sat down alone, he leaned forward and whispered, "Doc, I haven't had a real erection in over a year." He didn't want anyone to know. Not his wife. Not his friends. He thought maybe it was just age. But here's what I saw. A man who had ignored his penis for far too long. And now his body was sending louder signals. What most men don't realize is this. Your penis is one of the first organs to show signs of trouble. When blood flow weakens. When testosterone drops. When nerves start to misfire. Your penis knows before you do. It's why we call erectile dysfunction the canary in the coal mine. Because it warns you before disaster hits elsewhere, like your heart. There's a study that followed men who developed ED in their 50s or 60s. Within 7 years, 14% of them had a heart attack. That's not a coincidence. That's physiology. Erections depend on 3 major systems. Your blood vessels, your nervous system, and your hormones. When one of those starts to decline, your erections suffer. And if you ignore that, the rest of your body could follow. But here's the good news. If you listen to your penis, you can often catch problems early. You can get blood tests. You can adjust your lifestyle. You can start treatment while the damage is still reversible. Unfortunately, many men stay silent. They wait. They hope it will come back on its own. But in most cases, it doesn't. And the longer you wait, the harder it gets to recover. There's no shame in checking on your manhood. Look at it. Feel it. Notice changes in color, sensation, or firmness. And don't wait for total failure before you act. Even subtle changes, softer erections, less frequent morning wood, lower desire, are signals worth noticing. Because in my experience, the men who stay sexually healthy after 60 are the ones who treat their penis like a vital sign, not an afterthought. One patient once told me, "If I had listened to my penis earlier, I probably wouldn't have needed heart surgery." That stuck with me. Your penis is talking to you. Are you listening? Next, let's talk about what happens when men try to fix things on their own and end up making it worse. Mistake number 2. DIY tricks that can destroy you. He didn't want to spend money, didn't want to see a doctor. He saw a video online that claimed it would add inches overnight. So he followed the instructions. 3 weeks later, he couldn't get an erection at all. I wish I could tell you this is rare, but it's not. More and more men are turning to DIY methods to enhance their penis, and they're doing real, permanent damage. One of the most common is jelqing. This is a technique where men manually stretch the penis using pressure and motion, believing it will increase length. But what actually happens is micro tears, tiny internal injuries. Over time, these lead to scar tissue, curvature, and in many cases, erectile dysfunction. Another man I treated was in his early 50s. He had been jelqing for months. He told me, "I thought I was making progress. Then one day I noticed my erections were bending, and they didn't feel the same." What he was describing was early Peyronie's disease, a condition caused by trauma to the penile tissue. It started with a YouTube video. It ended with surgery. Then there are the homemade constriction rings. Yes, I've seen everything, from rubber bands to zip ties to plastic bottle caps. One man even used a metal construction nut. He ended up in the ER. His penis was swollen beyond recognition. We had to call the fire department to cut it off, not the penis, thankfully, but the nut. And in that moment, with his dignity shattered, he looked at me and said, "I just didn't think it would get stuck." Speech balloon, desperation makes men do dangerous things. But your penis is not a science experiment. There are safe, medically approved ways to treat ED, improve blood flow, or enhance performance. But pouring vinegar on your genitals, stretching them with tension, or using random objects from your garage is not the way. I understand why men try. They feel ashamed. They want results fast. They think natural equals safe. But not everything natural is harmless. And not everything on the internet is true. If you're thinking of trying something on your own, please stop. Ask a real doctor. Your penis is too important to gamble with. And if you're using any tool or technique right now that's not doctor approved, throw it away. The damage you cause today may not show up until years later. So now that you know what not to do with gadgets and gimmicks, let's talk about something much more basic, but just as dangerous when ignored. Mistake number 3. Poor hygiene that can lead to infection and cancer. He was 72. He came in complaining of some discomfort. Said it was just irritation. But when I examined him, I found something far worse. An open sore, redness, a strong odor. He hadn't been cleaning under his foreskin properly for years. And now, it was cancer. I wish I could say this was an isolated case. But poor hygiene, especially in older men, is a silent threat. Not just embarrassing, not just uncomfortable, but dangerous. Here's what most men don't realize. If you're uncircumcised, you must pull the foreskin back to clean. Every time. Not once a week. Not when it starts to smell. Every day. Underneath the foreskin, bacteria and dead skin cells collect. This buildup is called smegma. If you don't wash it away, it becomes a breeding ground for infections, like balanitis. It can cause swelling, burning, discharge, and intense discomfort. But that's not the worst part. Over time, poor hygiene can lead to chronic inflammation. And chronic inflammation in some men can turn into penile cancer. Speech balloon, just because it's rare doesn't mean it can't happen to you, especially if you're not looking. I've seen men who never learned how to clean properly. They were never taught. Or they felt too embarrassed to ask. Or they thought, I'm fine. I don't feel anything wrong. Until it was too late. One patient told me, I didn't even know I was supposed to pull it back every day. No one ever said that. That's the reality for many older men. No one talks about it. So let's make it simple. If you have a foreskin, you must gently pull it back. Use warm water. Let mild, non-scented soap wash through. Don't scrub harshly. Dry the area completely. Then gently slide the foreskin back in place. If you can't pull it back, that's also a problem. It might mean phimosis, a condition where the foreskin is too tight. Left untreated, it can trap bacteria and hide early signs of cancer. Sometimes creams or procedures can fix it. Sometimes circumcision is needed. But whatever the case, ignoring it is not an option. Even if you're circumcised, hygiene still matters. Use mild soap. Avoid strong fragrances or aggressive scrubbing. The skin down there is sensitive, treat it with care. Because if you don't, a simple oversight could cost you more than you ever imagined. Up next, something men ignore even faster than hygiene. Pain, sores, or blood. Let's talk about it. Mistake number 4. Ignoring pain and warning signs that could be cancer. He thought it was just a rash. A little sore on the underside of his penis. No bleeding. No pain. Just a small red spot. So he ignored it. For months. By the time he came to the clinic, the lesion had grown. It was ulcerated, bleeding slightly, and spreading. We ran tests. Biopsy confirmed what I feared. Penile cancer. He looked at me in disbelief. I didn't think cancer could happen down there. That's what many men believe. That pain, sores, or swelling must be something else. A bug bite, a scratch, an irritation. And yes, most of the time it's nothing serious. But when it's not, it can be life-altering. Penile cancer is rare. But when it happens, it's aggressive. And more importantly, it's preventable if caught early. The tragedy is not the diagnosis. The tragedy is how long men wait. I've treated men who delayed coming in because they felt embarrassed. Because they didn't want to bother anyone. Because they were ashamed of what their partner might think. Speech balloon, men are willing to lose a part of themselves, just to avoid being judged. And I get it. It's hard to show someone your most private part, especially when it's hurting. But avoiding the doctor doesn't make it go away. It only gives the problem time to grow. So here's what to watch for. Persistent sores that don't heal. Pain or burning during urination. Lumps or thickening of the skin. Changes in color or texture. Blood in the urine, especially without trauma. Don't Google it. Don't wait and see. Don't cover it with ointment and hope for the best. Make an appointment. Get checked. Might be nothing. But if it's something, catching it early can save your life. And save your penis. One of the most painful cases I've seen ended in partial amputation. A man who waited over a year. He told me, I was too scared to face it. But now I have to live with the consequences. Don't let that be your story. Pain, sores, swelling, these are not just skin problems. They are warning lights. And you can't afford to ignore them. Now let's move to something equally risky, but often misunderstood. Your performance in bed. Let's talk about control, speed, and safety. Mistake number 5. Losing control during sex can fracture your penis. It was supposed to be a romantic weekend. Just him and his wife. No distractions. A bottle of wine. Some music. A chance to reconnect. But during sex he slipped out. And then, it happened. A sharp bend. A loud pop. Followed by instant pain and swelling. He knew something was wrong. His penis looked bruised. It was curved, dark, and rapidly swelling. He couldn't pee. He couldn't move. He had fractured his penis. Yes, penis fracture is real. And yes, it's a medical emergency. It usually happens when the penis is fully erect and bends suddenly. Often during vigorous sex. Sometimes from an awkward position. Other times from missing the mark and hitting the pelvic bone. Inside your penis is a tough fibrous sheath, the tunica albuginea. It surrounds the erectile chambers and keeps blood trapped during arousal. When you bend forcefully, that sheath tears, and blood rushes out, causing swelling and pain. If left untreated, this injury can lead to erectile dysfunction, scar tissue, penile curvature, difficulty urinating, long-term sexual complications. Speech balloon: if you hear a pop, feel pain and see swelling, get to the ER. Fast. We can repair the tear surgically, and most men recover well. But the key is acting quickly. The longer you wait, the worse the outcome. Now you might ask, how do I prevent this? It's not about avoiding sex. It's about staying in control. Here's what I tell my patients. Avoid positions where you lose visual or physical control. Communicate with your partner, especially if things feel too fast or awkward. Don't rush. Use lubrication, always. And keep your hands on your partner's hips to guide movement. Lubrication matters more than you think. As we age, natural lubrication declines, especially for our partners. That's not a sign of low desire. It's just physiology. Lube makes things safer, smoother, and more enjoyable. One man told me, "I thought skipping the lube made things more passionate. Now I know better." He came in with a partial tear. Luckily we caught it early. So take it slow. Be intentional. And protect what matters. Because pleasure isn't worth it if it ends in a hospital bed. Next, let's talk about something even more subtle and far more common. Mistake number 6. Overheating your testicles without realizing it. He was trying to relax. A long soak in the hot tub every night. 15, 20, sometimes 30 minutes. It helped his back pain. It helped him sleep. But 6 months later, his testosterone was crashing. His energy was gone. His sex drive had disappeared. He thought it was aging. But his blood work told a different story. The real problem was heat. Too much of it. Too often. Most men don't realize this, but your testicles are temperature-sensitive organs. They're designed to stay slightly cooler than the rest of your body. That's why they hang outside, not tucked inside like the ovaries. Even a small rise in temperature, just a few degrees, can impair 2 key functions: sperm production, testosterone synthesis. So what's overheating your testicles? More than you think. Daily habits like sitting for hours with a laptop directly on your lap, keeping your phone in your front pants pocket all day, spending too much time in hot tubs, saunas, or steam rooms, wearing tight underwear that traps heat. One patient of mine used to take steam baths every evening. He felt relaxed afterward. But his testosterone kept dropping, even though his diet and exercise were perfect. When we cut out the heat, his levels bounced back. It was that simple. Speech balloon: your testicles are like a thermostat for your manhood, and heat breaks the system. Now, I'm not saying avoid comfort, but be smart. Here's what I recommend. Use a barrier between your laptop and your body, like a desk or cooling pad. Store your phone in your back pocket or jacket, not against your groin. Limit hot tub or sauna sessions to 10 to 15 minutes, max. Let your body cool down afterward. And when possible, choose loose, breathable underwear, especially when sleeping. Another man told me, "I had no idea my underwear choice could affect my testosterone." He switched to boxer briefs made of bamboo fabric. Within a few months he felt more energized and more confident in bed. It's a small change, but small changes add up. So if you're always hot down there, don't ignore it. Cool off. Your testosterone will thank you. Next, let's talk about a habit even more common and more damaging over time. Mistake number 7. Masturbating the wrong way and damaging your sensitivity. He sat down hesitant. His lab work looked fine. His testosterone was normal. His heart was strong. But he couldn't enjoy sex. He said, "I can get hard, but I don't feel much. And I can't finish unless I do it myself." So I asked him how he masturbated. He paused, then said, tightly, fast, always the same way. For years. And there it was. Many men, especially those who live alone or feel sexually frustrated, develop a habit. They grip too hard. They move too fast. They go into a private zone focused only on release. It's called the death grip. And it's more damaging than most realize. Over time, that intense, repetitive pressure desensitizes the penis, builds expectations your partner can't match, trains your brain to respond only to a specific, artificial sensation. It's like teaching your body to only respond to one type of stimulation. And everything else, a partner's touch, oral sex, real intimacy, suddenly feels dull or ineffective. One man told me, I used to think something was wrong with my wife, but now I realize it was me. I trained myself out of real pleasure. Speech balloon, when you teach your body to feel only one kind of pleasure, you close the door on everything else. So what should you do instead? First, slow down. Make masturbation feel more like real intimacy, not just a mechanical task. Use lubrication. Vary your grip, your speed, and your position. Allow your body to feel, not just finish. Masturbation isn't bad. In fact, it's healthy, physically and mentally. It can maintain erectile health, release stress, and keep your libido active. But the way you do it matters. If it's always fast, aggressive, and in secret, you might be harming your sensitivity without realizing it. If you're in a relationship, talk to your partner. Figure out what arousal means for both of you, not just what works when you're alone. And if you've already built bad habits, don't panic. The body can retrain. It takes time, patience, and a willingness to reconnect with your real self, not just the shortcut version. Because you deserve more than just release. You deserve connection. Next, let's look at a habit that doesn't just affect your penis, but your entire future. Mistake number 8. Smoking and living a lifestyle that kills erections. He hadn't smoked in front of his wife in years. But every morning he'd sneak out to the porch. 1 cigarette. Maybe 2. He said it helped him relax. Helped him focus. But what he didn't know was that every puff was slowly closing the blood vessels in his penis. When he finally came in, his complaint wasn't about energy or breathing. It was about his erections. They were fading. We ran the numbers. His testosterone was borderline. But his blood flow, terrible. That's what smoking does. It destroys vascular function, the tiny arteries that supply blood to your penis. Without proper blood flow, erections weaken. They disappear. No pill can fix that if the plumbing is shot. In fact, smoking is one of the top causes of erectile dysfunction, bladder cancer, hormonal imbalance, chronic fatigue, lower libido. One study showed that men who smoke are twice as likely to develop erectile dysfunction. And the more you smoke, the worse it gets. Even secondhand smoke can affect testosterone and sperm quality. Speech balloon, every cigarette is a direct hit to your manhood, not just your lungs. And it's not just about smoking. It's about your entire lifestyle. If you eat poorly, sit all day, drink heavily, sleep irregularly, carry stress without release, you're slowly turning down the volume on your sexual health. Erections are a reflection of your overall vitality. They require coordination between your heart, brain, hormones, and nerves. So when you live in survival mode, eating fast food, skipping exercise, ignoring sleep, your penis notices. But there's good news. You don't have to overhaul your life overnight. Start small. Here's what I tell my patients. Walk 15 minutes a day. Add 1 vegetable to every meal. Cut your smoking by 1 cigarette each week. Sleep before midnight. Practice deep breathing when stress builds. One man in his 60s did exactly that. No extreme diets. No gym memberships. Just consistent, small changes. 6 months later he came back and said, I feel like a man again. Strong. Clear. Alive. And yes, his erections returned. So if you're stuck in habits that feel comforting, ask yourself, Are they slowly killing the man you used to be? Next, let's go deeper into the mental side of manhood. Mistake number 9. Beating yourself up when things go wrong. He looked down the whole time. Wouldn't make eye contact. Finally, he said, "I can't do it anymore. I keep failing. And now I don't even want to try." He wasn't talking about his body. He was talking about his mind. That's what many men don't realize. Sex isn't just physical. It's deeply emotional. And when something goes wrong, a soft erection, a failed attempt, a partner's confusion, most men don't talk about it. They turn inward, and they blame themselves. It starts small. One night of underperformance. You tell yourself it was stress. Then it happens again. You begin to worry. And soon, every time you're intimate, you're waiting for failure. That worry becomes tension. The tension becomes distraction. And the distraction makes it even harder to stay aroused. Speech balloon. Your penis doesn't just respond to touch. It responds to fear, doubt, and shame. This is called performance anxiety. And it's more common than you think. Especially in men over 60, when the body naturally changes. Testosterone declines. Recovery takes longer. You may need more stimulation, more time, more connection. But instead of adjusting, many men judge themselves. They feel broken, less masculine, less wanted. So they avoid intimacy altogether. And here's the truth. That silence, that shame, causes more damage than any hormone ever could. One patient told me, "I used to feel like a man. Now I feel like a disappointment." It broke my heart. Because he wasn't. He just needed help, support, and a new understanding of what intimacy means after 60. So here's what I want you to hear. You are not alone. You are not broken. And your value is not measured by one night, one moment, or one erection. Stop beating yourself up. Instead, talk to someone you trust. Speak with your doctor. Explore options, medical, emotional, relational. Redefine success. Maybe it's connection, not performance. The men who recover best aren't the ones who push through. They're the ones who open up, who learn, who give themselves grace. Because manhood isn't about never failing. It's about how you show up after the fall. Now let's end with the most overlooked mistake of all. Mistake number 10. Believing that if you don't use it, you won't lose it. He hadn't had sex in over a year. Not because he didn't want to, but because life got complicated. His wife was dealing with health issues. He felt tired. The spark faded. So he stopped trying. And eventually, he stopped thinking about it. Until one day he noticed something different. His erections weren't the same. Softer. Less frequent. Sometimes nothing at all, not even at night. He came in quietly. "I think I broke something," he said. But he hadn't broken anything. He had simply gone too long without using it. Here's the truth most men don't hear. Your penis needs regular activity to stay healthy. Just like your muscles, just like your joints. If you stop moving, you lose flexibility, you lose strength, and you lose responsiveness. It's the same with your erections. During the night, healthy men get 3 to 5 erections, even without arousal. These nighttime erections are your body's way of pumping oxygenated blood into the penis. That keeps the tissue healthy. It keeps the vessels open. It prevents shrinkage and scarring. But if those stop happening because of age, illness, stress, or inactivity, your body starts to assume that part isn't needed anymore. Scar tissue can build up. The length and firmness can decline. And your sex drive can fade even further. Speech balloon. The less you use it, the more your body forgets it exists. This doesn't mean you have to be sexually active every day. But it does mean you need to stay engaged. That could be intimacy with your partner, self-stimulation with proper care, communicating your needs, maintaining desire through connection. It's about keeping your body in the game, and keeping your mind connected to your sexuality, no matter your age. One man told me, "I thought I was too old to care about sex. But once I started caring again, I felt alive. That's the magic. Not just of erections, but of touch, connection, pleasure, and knowing that part of you still works and still matters. So don't wait until you lose it. Keep it alive, keep it awake, and keep it yours. Now that you've seen the 10 biggest mistakes, let's bring it all together and talk about what to do next. Final message. Don't wait until it's too late. You've just heard 10 of the most common mistakes men make with their manhood. And maybe you saw yourself in a few of them. Maybe more than a few. That's okay. Because awareness is power. And it's never too late to take back control. What I've learned after years in urology is simple. The men who protect their sexual health the longest are not the ones with perfect genetics. They're the ones who pay attention, who ask for help, who stop doing the things that slowly kill their confidence, their connection, and their desire. If that's you, if you've ignored the warning signs, if you've pushed things aside out of fear, shame, or confusion, today is the day that can change. Start with one thing. Maybe it's checking for changes. Maybe it's throwing out bad habits. Maybe it's talking to someone for the first time in years. But don't wait. Speech balloon, you don't lose your manhood all at once. You lose it in pieces, unless you fight to keep it whole. You deserve to feel strong. You deserve to feel connected. You deserve to feel like a man, not just in body but in spirit. And if no one has told you this lately, your worth is not defined by performance. It's defined by how you show up for your health, your partner, and yourself. So ask yourself, what's one thing you'll stop doing today? And what's one thing you'll start? If this video helped you, leave a comment with your biggest takeaway. Like the video, share it with a friend, a brother, or a son. Because someone out there needs this, maybe more than you know. And if you want more honest, no BS health advice from someone who's seen it all, make sure to subscribe and turn on notifications. Take care of yourself. Take care of your body. And never stop honoring the part of you that still wants to feel fully alive.